characterized by excessive cell growth and dysfunction. The growth proceeds even after the cessation of the stimulus that provoked the growth. So, what is carcinogenesis? Carcinogenesis is how a tumor is evolved. These are some of the hypotheses of the origin of tumor. So, these four hypotheses includes the oncogenes. Previously, I told you that oncogenes are genes related to the tumor mutations. Genes which are mutated in tumors, they are called oncogenes. Oncogenes can be proto-oncogenes and can be tumor suppressor genes. Proto-oncogenes, they are inactivated, while tumor suppressor genes are activated in a normal individual. And when the opposite occurs, there is formation of a mutant gene and progression to the formation of a tumor. Then there are certain viruses which are involved in the tumors, epigenetic hypothesis, and the failure of immune surveillance. Then agents or etiological factors, or which we call them external factors, which we are going to deal in detail in this lecture. They are important in provoking these genetic mutations. So the origin of the neoplasia, as we did in the first lecture, that all the tumors are monoclonal. They arises from a single cell. So initiation occurs in a single cell. There is another concept of field origin. Field origin means that if the external stimulus, like viruses or any other external stimulus, is acting on more than one cell, the same mutation can occur in these cells, and they may form individual tumors in the tissue. So these types of tumors are called multifocal tumors, although they are occurring in the same tissue, but they arise from different cells of the same tissue. Like, for example, a hepatocellular carcinoma, if it is arising from a single cell or a monoclonal origin, it is going to form a single mass. But if you see two or three masses of the same variety in the liver, that is called a field origin, or that is called a multifocal tumor. Same case may occur in breast also. So this hypothesis says that there is initiation, that is the first event. In that event, carcinogen or the external factor may be involved, that is the etiological factor. Initiator is the carcinogen. And in the second event, there is promotion and progression of the tumor. That agent may persist or may not, but once there is mutation and there is initiation, even if the agent is removed or the carcinogen is removed, the tumor keeps on growing. So you need a multiple number of mutations for the tumor to present clinically. So lag period is time between the exposure or the first hit, that is the first mutation, and the development of a clinically apparent cancer. And as I told you that tumor must be at least 1 centimeter large to present clinically with some clinical signs and symptoms. So we looked at this picture previously also in one of the lectures. This picture shows the formation of a squamous cell carcinoma on skin, or maybe in the cervix or in the respiratory tract. The tumor starts from a single hit. Tumor starts from a single cell, and then there is formation of carcinoma in situ. And if there is breach in the basement membrane, there is local invasion. But this diagram here is emphasizing on the lag period, on the time taken from the first initial hit till the formation of the invasive tumor. So there can be primary prevention, like removal of the tumor or the agent, even before there is carcinoma in situ, you may remove the agent. So there are multiple genetic mutations till the formation of an invasive tumor. So oncogenes, there are two types of oncogenes, proto-oncogenes and tumor suppressor genes. Proto-oncogenes can code for growth factors. Growth factors are normally also present in the body. There are receptors for those growth factors, or there are signal transduction factors in the cytoplasm of a cell. So tumor suppressor gene codes for factors that downregulates the cell cycle. So P53 and RB gene is already present in the cells, and they are tumor suppressor genes. Actually, they are activated in the normal individual, but if they get mutated and they are downregulated, there is formation of tumor. These are the genes which are actually regulating the cell cycle. So P53 is also called the guardian of the cell cycle, or the guardian of the cell. So if there is any mutation, the cell is prevented from dividing into two in a normal individual or a normal tissue. But if this gene get downregulated, or if this gene get mutated, the P53 or RB gene, so these are tumor suppressor genes. Proto-oncogenes, they are actually inactivated in a normal individual, but whenever they get activated, they may produce a number of growth factors. They may produce mutant receptors, or they may produce certain factors which are involved in the cytoplasm signaling. So this is a normal cell. In a normal cell, you can see that there are growth factor receptors, there are growth factors, cytoplasm, and the signals, they are transmitted through the cytoplasms to the nucleus. And then there is activation of transcription. So this is what we have already done, that gene activation and inactivation is important. So oncogenes is a big term, is a big heading, under which we have proto-oncogenes and we have tumor suppressor genes. So how these proto-oncogenes get activated, there can be a point mutation in which only a single point of the gene or a single nucleotide is mutated. There can be translocation, or there can be gene amplification. Amplification means multiplication, or a number of mutant genes produced. So this is a cell showing growth factor receptor. There are growth factors, and if there is mutation in a gene which is producing growth factor receptors, this is just an example that we are taking for the formation of tumor. We are taking the example of a growth factor. So if there is a mutation in a gene which is producing a growth factor on the cell, instead of producing a single growth factor, there can be a number of growth factors on the cell. Because growth factors are present around the cell, they are going to attach to that growth factor receptor, and there is rapid multiplication of the cell. This is not a normal procedure. So if a single receptor or more than one receptor is needed on the cell, there are thousands of receptors present in case of a neoplastic cell. So see this, there is increase in the growth factor receptors, so their all those receptors, they are going to attach the growth factors, which is present around the cell normally also. But if a single receptor is present, only a single growth factor is going to attach, and that is a normal growth, but or a normal division. But in case of a tumor cell, there may be a multiple receptors, or if there is a mutant growth factor, so that will also induce the formation or the appearance of receptors. So both ways, that depends on which type of gene or which gene product is actually mutated. In cases of viral oncogenesis, there are RNA viruses and there are DNA viruses. So viruses are notorious for causing cancers. So RNA retroviruses produce DNA proviruses. So DNA proviruses contain viral oncogenes, which is called VON, and it is introduced into the host, and that is inculcated into the DNA of the host, and it is going to produce a mutant proteins and mutant receptors. So RNA viruses, they are more notorious than the DNA viruses. DNA viruses do not contain viral oncogenes. They act just by blocking the suppressor gene product. For example, human papilloma virus, Epstein-Barr virus, and HBV. In case of hepatitis B and C, hepatitis B virus is more notorious for producing tumor directly than the hepatitis C virus. However, in case of hepatitis C, the tumor in case of hepatitis C is more than hepatitis B. That is not because directly because of the virus itself, but it is because of the chronic disease that that is going on or producing changes in the liver for a long period of time and causing the liver to get cirrhotic. That cirrhotic liver and changes in the cirrhotic liver may lead to the production of hepatocellular carcinoma. But hepatitis B virus can directly cause cancer, but that is not common. So in case of hepatitis B and C, hepatitis C patients are more prone to have hepatocellular carcinoma later on in a cirrhotic liver, but that is not directly because of the virus. In case of Epstein-Barr virus and human papilloma virus, they can directly cause tumor by blocking the suppressor gene products. That is the product from the tumor suppressor gene that we already did. P53 is very important, and RB gene is important. Epigenetic hypothesis means that the gene which is uh, producing any product is not actually mutated. It is the product uh, which is formed that is defected. So the gene directly is not mutated in itself, but the product that may be defected, so it is not producing the same normal effects on the cell as in the normal individual or a tissue. And another important thing in epigenetic hypothesis is that if a factor or an external stimulus is acting on a gene, that may produce mutation in the surrounding genes also. So there is a widespread effect. So not the same gene which is affected directly by the factor or the etiological cause, but the surrounding genes, they are affected, and those are sometimes the genes which are involved in growth of the cell. So epigenetic hypothesis is that either the genetic the expression of the genetic apparatus is changed. The protein which is formed by the genetic apparatus, it is totally changed, or the gene which is mutated also mutate the genes surrounding that individual area. Failure of the immune surveillance. So because a new plastic cell is a foreign cell for the body, so our immune system is going to get activated, and it is going to recognize a tumor cell as a foreign cell. So as we discussed that because tumor is under no control and it is growing so rapidly, so our immune system, apoptosis, they are not enough to withhold that tumor or tumor growth. So it is actually going to escape the immune surveillance. So it is because of the altered DNA resulting in production of neoantigen. Neoantigen means that they are antigens produced by a tumor cell, or there are certain tumor associated antigens. This point we are going to discuss in tumor immunology in the next lecture. Immune response to cytotoxic neoantigen as a foreign antigen. We did this in the second chapter, that cytotoxic T cells, they are important in recognizing tumor cells as foreign. So in the immune system, cytotoxic T cells, they are going to recognize tumor cell, through tumor necrosis factor beta, and they are going to uh, cause their death. But again, because tumor is growing so rapidly, this system is not going to be enough to demolish all the tumor. So a neoplastic cell escaping recognition and destruction becomes the clinical cancers. So these are some of the not hypotheses, but now these are the actual facts that how a tumor is produced. So if in one word, what is carcinogenesis or how a tumor is produced? One word is mutation. So mutation is very important, and without a mutation, a tumor cannot evolve, whether it is a benign or a malignant tumor. So if the basement membrane is ruptured in case of a malignant tumor arising from an epithelium, it is going to form an invasive tumor. And because the lymph vessels and the blood vessels, they are present in the cytoplasm, they may go elsewhere and form distant metastases. So a tumor cell is going to produce certain factors and certain enzymes, which are going to first destroy the laminin in the basement membrane, and then the basement membrane itself, and then metalloproteases, which are going to destroy the connective tissue, and the cell may go into a blood vessel or a lymph vessel. Cadherins are molecules, or they are proteins which are actually binding the cells in case of an epithelium. So cadherins are binding molecules. This again is one protein which is destroyed by the tumor cell itself, because they produce certain factors or certain enzymes which are going to destroy the cadherin molecule. And that is a one mechanism that how a single neoplastic cell can escape the entire epithelium. So that is how a single neoplastic cell can escape the entire epithelium, or it uh, in other words, I can say, okay, this is how it can become free from the epithelium, so it is free to go anywhere in the body now. So cadherin molecules, they are destroyed, laminin molecules, they are destroyed, and basement membrane in basement membrane, collagen 4 is destroyed by the tumor cells themselves, because tumor cells are under no control. So they are producing certain enzymes which are going to keep on destroying the surrounding tissue. So this is a summary what we have done till now. There is carcinoma in situ in case of epithelium, not in case of a sarcoma. There is invasion of the basement membrane. Then there is local invasion and distant metastasis. So this is the summary. Environmental factors. Then there are changes in the genomic cells, activation of growth promoting oncogenes, inactivation of cancer suppressor genes, and expression of all altered gene products and loss of regulation gene products are going to form a malignant neoplasm. So carcinogenesis also involves etiology. Etiology means the factors or the environmental factors which are important in producing or initiating the mutation or a change in a gene. So these are some of the agents which can be one of the etiological factors. So there are chemical oncogenesis, there is radiation oncogenesis, there are viruses which can produce mutation. There are nutritional, hormonal, and genetic factors. So let's discuss each of them separately. So a carcinogen is a substance that causes cancer or produces an increase in the incidence of cancer in humans and in animals also. So in case of chemical carcinogenesis, chemicals can act in two ways. They can proximate or directly act on the cell and produce a mutation, or can produce a metabolic change. And then they can act indirectly by producing metabolic products first in the body, and those metabolic products are actually carcinogens. So in case of indirectly acting chemicals, those chemicals are actually pro-carcinogens that will form carcinogens in our body as a byproduct when they are metabolized. But in case of directly acting carcinogens, they are called carcinogens for the very first time. So these are some of the notorious metals or the carcinogens, some of the notorious. So arsenic, beryllium, cadmium, lead, nickel, chromium, and a number of others also. So they may induce changes in the DNA. So these are some of the mechanisms that may include deletion, breakage, cross linkages, and alkali, alkylation. So epigenetic mechanisms may involve mutation in the surrounding genes also. Then there may be synergistic action with the viruses. So if there is a chemical carcinogen and there is a viral infection also by certain viruses which contain oncogenes, that may enhance the probability of having a cancer. So difficulties in identifying carcinogens include that there are numerous industrial, agricultural, and household chemicals. But sometimes you may pinpoint a carcinogen in a product, or sometimes there are numerous carcinogens in which you may not, you are not able to pinpoint a single. And a very good example is tobacco smoke that contains a number of chemicals, and you cannot pinpoint any one that this one chemical is a carcinogen. So as a whole, tobacco smoke is considered as a carcinogenic agent. So there is a lag time in case of chemical carcinogenesis. There is a long lag time actually. So from the exposure till the production of the clinically presentable tumor. So look at this tobacco smoke that contains a number of chemicals. You cannot even count them, or you cannot even say that which one of them can be carcinogen. So tobacco smoking is one of the cause of tumors. And you all know that it not only produces lung cancer, but can produce oral cancers, laryngeal cancer, pharyngeal cancer, urinary bladder tumors, and many, many others. So the duration is important. Cigarettes smoked per day, number of cigarettes smoked per day, and the time period is important for the production of cancer. Again, that depends on individual also. Sometimes two individual having same number of cigarettes per day, one of them may develop a tumor, the other may not. So again, that the production of a tumor is not a single agent mechanism. It may involve many other factors also. So it is a complex pathogenesis and a complex mechanism. So you may say, okay, one of the guys who is smoking cigarette for a long period of time may not develop lung cancer, and the other who smoke for a lesser period of time may develop lung cancer. So in cases of chemicals, solvents like benzidine, like alanine, and beta naphthalene, these are three chemicals which are important in producing urothelial carcinoma, carcinoma of the urinary bladder, or the ureter, or the pelvic or calyceal system of the kidney. So aniline, beta naphthalene, and benzidine. So these are used in leather industries and tanneries. In cases of fibers and dust, the occupational lung diseases are the examples. So asbestos is one of the good examples, which produces tumor in lung, as well as pleura, mesothelioma, and adenocarcinoma of the lung. Dioxides used in industries, and the dioxides are also one of the byproducts of pesticides and some industrial uh, procedures. In case of food, uh, chemicals related to food, they are polycyclic aromatic hydrocarbons. That basically means that the foods that are directly cooked on the coal, they may sometimes produce cancer, because they produce nicotinamide, nicotinamides and polycyclic aromatic hydrocarbons. So areas where the food is directly burned on the coal, and people are only taking such type of foods, may uh, end up in having gastric and intestinal carcinoma. So one of the examples is smoked fish in Japan. So in case of Japan, gastric carcinoma is very prevalent, and Japan is the number one country in the world where gastric carcinoma is prevalent. Other carcinogens in the chemical category involve vinyl chloride, and vinyl chloride is involved in plastic industry, and in plastic pipes, plastic containers. It is one of the chemicals which is causing tumor in the liver, that is angiocarcinoma of the liver. So hepatic angiocarcinoma is caused by vinyl chloride. Benzidine, as we already did, that in case of leather industry and tanneries, benzidine can cause urothelial carcinoma. So this is a list, just a summary of chemical carcinogens. So look at this, that a single chemical may produce cancer at a number of sites in the body, or it may produce cancer at only one site also. And this table also shows some of the products in which these chemicals are used. It is not that we are not going to use these products. It is that this slide shows that prevention is essential. So in cases of occupational lung diseases, in cases of people working with these chemicals, in cases of people working in such industries in which these chemicals are used, periodic health examination is mandatory, and any symptom or any such sign which is indicative of any abnormality, the person may be withdrawn from that area. So risk assessment is important in case of industries or occupation where chemicals are used. So potency, type of exposure, and dose, or the time period, and the dose, the daily dose of the chemical is important. So occupational cancer risks are important. In cases of radiation, ultraviolet radiation is one of the notorious which can produce skin cancers. X-rays is the second, which can produce a number of cancers. Then radioisotopes or nuclear fallouts can be others. So cosmic radiations directly, and those people who are having hereditary diseases in which there is abnormality in the gene repair system in the skin, like xeroderma pigmentosum, they are more prone to develop skin cancers. So ultraviolet radiations directly can produce squamous cell carcinoma of the skin, basal cell carcinoma, and malignant melanoma of the skin. So fair skinned and elderly, they are more susceptible. Fair skin because melanin is less, which is one of the protective pigment in the skin. Infrared radiation cannot cause cancer. So infrared radiations are not producing cancer. Ultraviolet radiations, they are producing cancers. So we can use protective paints or protective shields or protective glass in the windows to avoid direct sunlight. Again, X-ray radiation that may cause skin cancer, that may cause leukemia, and that may cause thyroid cancer. These are some of the common, but others also include bone cancer and breast cancer. So avoid unnecessary X-rays in radiology or CT scan. So whenever it is required, only then order the X-ray. So without any indication, please avoid X-rays and CT scans. A pregnant female is never exposed to X-rays because there may be some fetal abnormalities, and X-rays, frequent X-rays in young age may cause development of breast carcinoma in the later ages. So during diagnostic and screening X-rays, the patient must be wearing a shield, and the radiologist or the radiographer must be in a protective room so that only the exposed part is screened. Radioisotopes used in certain nuclear medicine fields and in radiology may cause tumors. So osteosarcoma can be caused by radioisotopes. Some of the miners working in the mines where they are digging for radioisotopes may have lung cancers. Thorium was one of the radioisotopes previously used in radiology. Uh, it can cause liver cancer, angiosarcoma, which is a malignant tumor of blood vessels, and cholangiocarcinoma, which is a malignant tumor of biliary tract. So radioactive iodine again have a risk of cancer, but it is also used in treatment of papillary carcinoma thyroid. So it is not that it is that we are going to not we are not going to give the patient radioactive iodine in if the patient is a papillary carcinoma thyroid patient, but the dose is important for the patient, the duration is important for the patient, and the exposure to others is important. If the patient is exposed to radioactive iodine and he's a patient of papillary carcinoma thyroid, it is for the benefit of the patient, but it is not beneficial for others. So once the patient is given radioactive iodine in case of papillary carcinoma thyroid after surgery, uh, he is isolated from his family for a day or two, so that it can act only on the patient. So radiation therapy again, in radiotherapy and nuclear medicine, it is important that only the exposed area is getting the radiation. So radiations are given in cases of tumors, but they are not, they must not expose uh, to the other parts of the body which are normal, that may produce tumor. So protection and prevention is important. Radon is a gas which is used in the West for heating purposes, for centrally heating purposes. It is not mostly used in our country, but it can be one of the carcinogens if it is leaked. Nuclear fallout in cases of Hiroshima and Nagasaki, and areas where there is nuclear leakage, tumors may be produced after some time, after a lag period, because there are going to be mutations. Tumors cannot suddenly occur if there is a nuclear fallout. There is necrosis, inflammation, and death in acute cases, but after a period of time, the people who survived this nuclear fallout may get tumors.
Excuse me, sir. Sorry for interruption. We
Okay,
need to end the lecture as we have the next lecture in line.
okay. So I'm